Good morning, everyone. I'm Rebecca, the floor manager at Randall Mill Pharmacy.
And I'm Patrick. I'm the pharmacy manager at Randall Mill Pharmacy.
Today, we're going to be talking about COVID vaccines, including basic information, common myths, and recent updates. So, Patrick, can you tell us what COVID-19 vaccines are available right now?
Yeah, so let's start out simply. So there are 3 COVID vaccines that are approved in America as of right now. We have Pfizer, and currently Pfizer is approved for people 12 and up, and it's a 2-shot vaccine, and the shots are separated by 3 weeks. Then we have Moderna, and that vaccine is currently approved for people 18 and older. It's also 2 shots, but those 2 shots are separated by 4 weeks. Then we have the Johnson & Johnson vaccine. That's also for people 18 and older. However, that's just 1 shot, and you don't have to have a second shot or follow-up for that one initially.
Alrighty, and what are some of the side effects that you might see?
Sure, so some of the side effects of the vaccine are pretty typical for most vaccines, I would say. As far as the actual injection site in your arm goes, you may have pain, redness, swelling. Most people tell me that their arm is sore for a couple of days. I would say that's what I'm hearing the most. And then just as far as overall your body, you may have body aches, you may have a slight fever. Most people the next day with all 3 vaccines may feel kind of tired, like they have a lack of energy, but it's usually just 1 day. And then after that, you're feeling good again. A few people have told me headaches as well, but again, it's really not anything different than you would see from any other vaccine.
So now that we've gone over the vaccines, what are some of the common myths that we're hearing?
Okay, so let's start with a myth that I have heard at the pharmacy, where some people have asked me if getting the vaccine helps push along and cause new variants. And the answer to that is actually no. Variants arise just kind of naturally as a virus kind of progresses and infects different people. It can kind of change over time. And so for instance, the Delta variant, that wasn't caused by the vaccine. It just was kind of a natural mutation with the virus, unfortunately. And it's just kind of a natural progress that every virus goes through.
So should I get vaccinated even though I have COVID?
Yes, yes you should. And the idea behind that is if you've had COVID once, that doesn't mean that you won't get COVID in the future. So if you get the vaccine, it still helps you create antibodies and gives you a better chance to prevent catching COVID in the future. Now there are a couple caveats to that. One being if you had COVID in the past and you got the monoclonal antibody IV treatment, you want to wait at least 90 days before you get the COVID vaccine. Also, people that take regular medications, regular medications don't affect the vaccine at all, but one group that you do want to talk with your doctor about is if you take immune suppressing medications. So that would be people that have had like an organ transplant, typically take immune suppressing medications and some type of cancer treatment. So talk with your doctor about that, and y'all can decide when would be the best time to get the vaccine. And while we're talking about medicines, let me briefly say that after you receive the vaccine, it's okay to take things like ibuprofen or Tylenol or even Benadryl if you want to, but those things are typically not recommended to take before you get the vaccine. So just remember, when you come in to get your vaccine, you don't really want to take anything, but then after you get your vaccine, ibuprofen and Tylenol are perfectly fine to take.
So Patrick, is the mRNA vaccine actually a vaccine?
Yeah, that's a good question, and I've actually had that one from quite a few people at the pharmacy. And yes, it's new, but it's new in the sense that this is the first time mRNA vaccines have been used in the general population. It's not new in the sense that there has been research and development on that for the past decade. So yes, it is the first time that that's been used. But again, the idea and the process and the development have been around for quite a while on that. So the way that mRNA vaccines work is they they get injected into your body takes up that vaccine and then produces a protein that is found on the virus's surface, and then your immune system recognizes that protein and builds antibodies to it. The way other vaccines typically work, for instance, Johnson & Johnson works by introducing a piece of the virus, or even sometimes different vaccines will introduce just a weakened version of the virus, and your body makes antibodies to the virus in that way. So it does work differently, but it is still very effective.
So will getting a COVID vaccine give me a positive reading for the COVID test?
Yeah, that's also a very good question, and here's the answer to that. No, initially, if you're getting a test to see if you currently have the virus, if you feel bad, you're in a fever, you want to know, hey, is this COVID or is this something else? If you take an antigen test, a vaccine will not affect the results of that test. However, there is another test out there called an antibody test, and most people take that to see if they've ever had COVID in the past. You know, maybe you felt bad at one point last year, you weren't sure if you had COVID, and now you're wondering, well, you can take an antibody test, and if you do have antibodies, it could mean that, yes, you did have COVID, and maybe you just never got tested at the time. Because the vaccine helps your body produce antibodies, then yeah, you could get a positive test on an antibody test from the vaccine. So no, if you're trying to see if you currently have the virus, but possibly yes, if you're checking to see if you ever had it in the past.
Okay. And so Patrick, what are some of the updates on the COVID vaccine?
Okay, so the most recent update we've received is about the Pfizer booster. And so anybody that was initially vaccinated with Pfizer, you got your 2 shots. You have to wait at least 6 months, and then you can come in and you can get that 3rd shot for your Pfizer booster. Now there are just a few stipulations about who can get the vaccine. Most people that come into the pharmacy are eligible, but just in case you're wondering, specifically it's anybody that's 65 and older, you can get the Pfizer booster if you were originally vaccinated with Pfizer. Anyone that's 18 and older that lives in a long-term care setting, anyone that's 18 and older that may have underlying medical conditions, which I know a lot of our patients specifically fall into that category. Anyone that's 18 or older that works in a high-risk setting. So for instance, I would be considered as working in a high-risk setting, a healthcare professional, anyone that's a first responder, things like that. There's a more complete list on the CDC website if you want more information about that. And then lastly, anyone 18 or older that lives in a high-risk setting. So again, it covers a lot of people. But if you are interested in finding out more information about that specific list or any of the other myths, I couldn't cover them all here. All this information that I've talked about today is coming from cdc.gov. Let me also just quickly say that as of right now, Moderna and Johnson & Johnson boosters are under review, and we're hoping to hear something this week, if not next week. And as soon as they are approved, we are currently giving Pfizer and Moderna and Johnson & Johnson shots at the pharmacy. We do those Monday through Friday from 12 to 6 p.m. Right now also flu shots are very popular, and we have the high dose version for people 65 and over, and we have just the regular flu shot. You can come and get those anytime the pharmacy's open. And of course, we do still give shingles vaccines and pneumonia vaccines and whooping cough. So if you have any questions, feel free to give me a call, or you can just come to the pharmacy to get a vaccine from me.
Thank you for watching this video today. If you have any questions, just comment below. And remember to like us, subscribe, and share this video, and follow us on Facebook, YouTube, Instagram, and stay safe, stay well, and we'll see you next month.